On today's Two on Your Side Town Hall, there are still more large gatherings expected this New Year's weekend, which health officials believe will lead to more COVID cases. How schools are trying to balance both safety and learning when they resume next week. Plus, this month actually marks 2 years officially since the COVID-19 pandemic began overseas. The World Health Organization talked today about where things stand 2 years in. And later, it is traditionally a busy week for ski resorts and other winter sports, but Mother Nature isn't exactly cooperating, at least so far. We're going to talk with Holiday Valley about what they're doing in the absence of the natural snow. Thanks so much for being here on the Town Hall this Wednesday. I'm Kate Welshofer. The number to text us your comments or your questions right there at the bottom of your screen, 849-2220. And you can reach out with that number anytime to discuss things that you would like to see right here on the Town Hall. But we do want to begin with the COVID-19 pandemic and where health officials and lawmakers are focusing their attention this week. And that includes the pending return to schools after the break, where cases are expected to be on the rise in the wake of holiday gatherings. We'll also get to hear from the CDC's director about why they made some of those changes to quarantine guidelines earlier this week. And we're going to hear from a number of public health officials this half hour, but we're going to start with Governor Kathy Hochul, who spoke about the pandemic while she made a stop at a vaccination clinic up in Plattsburgh this afternoon. She says she was on a call with 500 superintendents from across the state yesterday to talk about the safest ways to return kids to classrooms. And while the state and districts understand the Omicron variant is spreading quickly and getting us to a record number of new cases, the emphasis, they say, has to be on educating children in classrooms.
We saw with the isolation from remote education how much that took children down to a place of just isolation and loneliness, and not having that connection with other classmates and their teachers really took an emotional toll on them, and we're seeing that now. That's why we know we have to make sure that kids end up back in school.
Our Ron Plants will have another report on the plans from the local districts to safely bring back students from break, coming up on Channel 2 News at 6. We've also reported all week on the CDC's changes to quarantine or isolation guidelines, shortening that from 10 days to 5 days in most cases. And today we got to hear from the CDC director about it during an appearance on the Today Show.
So we followed numerous areas of science in making this important decision. One, of course, was how the virus behaves. How much virus do you still have that you could potentially transmit after 5 days? And we generally know that most of your transmission potential happens in those 1 to 2 days before you have symptoms and those 2 to 3 days after. So by the time 5 days of isolation has occurred, you probably have about 85 to 90% of all of your transmission potential behind you while you've been in isolation. And many people are asymptomatic or only mildly symptomatic, especially those who have been vaccinated or boosted. And so they may very well not be able to or willing to comply with 10 days worth of isolation. So this was really a way to tell people, make sure you isolate in those first 5 days when you're maximally infectious, and then of course wear a mask for those last 5 days to make sure that you don't spread anything that might be left over to others.
Meanwhile, the FDA is warning people that rapid antigen tests may not do a very good job detecting the newer and highly infectious Omicron variant. The Food and Drug Administration conducted a study alongside the National Institute for Health, and the study found that rapid antigen tests do detect the variant, but with reduced sensitivity, which could result in a false negative, especially when infection is just beginning. But the FDA says it is still supporting using the rapid test as a way to gather information, something the CDC agrees with. But they also agree that PCR tests are still the best way to be sure.
We do know that the antigen test may not perform as well as it had for prior variants, the Alpha variant and the Delta variant, but it's still picking up quite a bit of infection. So a really, really helpful tool. But what we would reiterate, and is also in our guidance, is that if you have a negative antigen test and you have symptoms, then you should go ahead and get that PCR test.
And the CDC reiterated that the new guidelines are largely in place for people to get back to work more quickly when they're healthy and to prevent asymptomatic and vaccinated patients from having to isolate for 10 days. Today, the World Health Organization held a news conference to mark 2 years since the start of the global pandemic. The director of the WHO says that he is concerned about complacency around the world, as well as vaccine hesitancy, which he views as largely being fueled by politics and misinformation.
While science delivered, politics too often triumphed over solidarity. While there were 1.8 million recorded deaths in 2020, there were 3.5 million in 2021, and we know the actual number is much higher. In the huge waves of cases currently seen in Europe and in many countries around the world, misinformation, which has driven vaccine hesitancy, is now translating to the unvaccinated disproportionately dying.
Our local infectious disease experts that we've spoken with this week, like Dr. Thomas Russo and Dr. John Selleck, continue to urge everyone to consider getting vaccinated if they have not, and to get their booster shots if they're already fully vaccinated to help save lives this winter.